Cancer is the uncontrolled growth of abnormal cells and is able to become invasive when the cells start to invade other tissue. Normal cells can become cancerous cells by the accumulation of defects or mutation in their DNA. Cancer cells continue to proliferate and can ignore the signal, which usually tells the cells to stop dividing, as well as influence normal cells to feed the tumor by inducing oxygen and nutrient supply from the blood vessel, which helps cancer cells to grow. Cancer can be classified into two types, benign tumor and malignant tumor. Benign tumor, a non-cancerous, is a mass of abnormal cells grow locally and do not spread, thus it is not considered as cancer because they do not spread themselves to other parts of the body. For malignant tumor, it is a cancer that has the ability to spread and invade other parts of the body. This process is known as metastasis. The common treatments for cancer patients are radiotherapy and chemotherapy. Radiotherapy has two types, external and internal radiotherapy. External radiotherapy is a method which a high amount of X-ray energy is aimed at the affected area using a large machine, whereas the internal radiotherapy requires low amount of X-ray energy, whereby a material which is temporary or permanent is placed near to the affected area. Chemotherapy has two types, neoadjuvant and adjuvant chemotherapy. Neoadjuvant chemotherapy is a treatment where chemo drugs are given before the surgery. Its objective is to shrink the tumor size in order to prevent risk of excessive bleeding and also to observe tumor response during chemo infusion. Other than that, adjuvant chemotherapy is a treatment given after surgery. Its objective is to clear the remaining tumor cell in the system or one that spread to other parts of organ in the body, as well as preventing the risk of cancer from coming back.
Case presentation. There is a 57 years old male patient. He is an Iban and lives in Kapit. He has been retired as a lorry driver for the past 5 years ago. Patient diagnosis is nasopharyngeal carcinoma stage 3. He has been admitted on 22nd October 2019 to undergo third cycle of chemotherapy in male radiotherapy unit. He has no allergies to food or medications. Next, for the current hemodynamic status, the blood pressure is 129/72 mm mercury. The heart rate is 85 beats per minute, respiration rate 21, SpO2 97%, and the temperature is 36.7 degrees Celsius. During the interview, patient complained of, firstly, loss of appetite due to oral mucositis, which is ulcer in the mouth, for the past 4 days before admitted. Secondly, the pain score of the ulcers are 2 out of 10. Then, no fever, no vomiting, and no diarrhea. Health history. In May 2019, patient complained of neck swelling over right side for a week with no pain or other symptoms. He has been undergo some tests and procedures such as fine needle aspiration cytology (FNAC) in June, both scope and histopathology examination, which is HPE test, which has been done in July 2019. The result of HPE was non-keratinizing NPC. Since then, he was diagnosed with the nasopharyngeal carcinoma stage 3 in August 2019. For the first cycle of chemotherapy has been done in September 2019 at Sarawak General Hospital, and for the second cycle is in October 2019 at Cebu Hospital. Patient also has underlying disease of hypertension, dyslipidemia, and diabetes mellitus since 2014. He is an ex-smoker and ex-alcoholic for the past 15 years. Lastly, patient stated that no family history of cancer.
I will explain about the disease process and management and outcome of the patient. Nasopharyngeal carcinoma is a type of head and neck cancer. It is a cancer that occurs where the malignant cells form in the tissue of the nasopharynx that is located behind the nose and above the back of the head. Some of the risk factors that may cause the person to get nasopharyngeal carcinoma include gender, where it occurs commonly in male compared to female, age where the adults between the age of 30 to 50 are usually diagnosed with this cancer. Country or region. It happens frequently in southern China and Southeast Asia, such as Hong Kong, Vietnam, Singapore, Malaysia, and Philippines, as well as northwest Canada and Greenland. Diet. Nasopharyngeal carcinoma diagnosed patients are usually takes diet very high in salt, cured fish, and meat. Epstein-Barr virus infection. Majority people who develop NPC show evidence of Epstein-Barr virus infection in their blood. Last but not least, individuals that smoke and drink also have a high risk of developing nasopharyngeal carcinoma. Some of the symptoms of nasopharyngeal carcinoma may include nosebleed, hearing loss, sore throat, headaches, and lump in the neck because of the swollen lymph node. Nasopharyngeal carcinoma is diagnosed with some numbers of different tests, which include nasendoscopy. A thin, flexible telescope endoscope is inserted into the nose and passed through the throat to identify any signs of abnormalities. Imaging scans such as MRI or CT scan, as well as biopsy. The treatment for nasopharyngeal carcinoma are radiotherapy, where it uses high-energy X-rays to kill the tumor cells as well as to keep them from growing. Chemotherapy, where it uses drugs to stop the tumor cells from growing either by killing them or stopping them from dividing, as well as surgery. Management of the patient. Patient is currently undergoing chemotherapy. Before he proceeds with his chemotherapy, patient is given hydration therapy. The hydration regime is as follows. Patient chemotherapy plan are as follows. There are pre-medication drugs, chemotherapy drugs, and post-medication drugs. Besides chemotherapy drugs, patients also currently on medications such as tablet multivitamin used to provide vitamins that are not taken through the diet, syrup Benadryl, and antihistamine used to treat symptoms of allergy, fever, and common cold, and tablet bromhexin helps to clear the mucus from the respiratory tract by thinning the phlegm in the airways and facilitating the removal of the mucus. Besides medications, patients also on current plans such as IV drip or normoxilin 2 liters per day, hypocount monitoring 4 times a day, encourage oral intake as well as 24 hours urine collections. For the outcome of the patient after the chemotherapy, based on the observations as well as patient's verbalization, patient complained of not having any side effects of chemo drugs except for mouth sore. He complained pain score of 2 out of 10 because of the mouth sore, and also due to that, patient has loss of appetite because of the pain.
The first nursing diagnosis for this patient is altered oral mucosa membrane related to disruption of renewal process of mucosa epithelial cells associated with toxic effects of cytotoxic drugs after the chemotherapy, as evidenced by patient has ulceration inside the mouth and have difficulty in chewing food and drinking. So the first intervention is assess sign of dryness of oral mucosa and symptoms of ulceration for early detection of abnormalities. Secondly, encourage patient to maintain good oral hygiene after meals, which can help in maintaining a healthy oral mucosa membrane. Thirdly, encourage fluid intake at least 2,500 ml per day unless the patient is contraindicated, which can keep the oral mucosa moist and prevent from dryness. Lastly, advise patient to avoid substances that may irritate oral mucosa like spicy food, hot food, or hot fluids, and it can help to prevent trauma to the oral mucosa. Second nursing diagnosis for this patient is imbalanced nutrition less than body requirements related to altered oral mucosa, as evidenced by patient verbalize of pain due to ulcer inside the mouth and has no appetite to eat. The first intervention is we can assess oral cavity at least once daily and note any lesions, bleeding, or dryness, and it can help to treat the causes of the symptoms that is occur. Secondly, encourage patients to take small amount of food but frequent, because most of patient who has no appetite seems to take smaller portions of food first. Thirdly, adjust diet as tolerating by patient by avoiding spicy food or hot food, because it can prevent patient feel more pain and uncomfortable inside the mouth when eating or drinking. Lastly, we can advise patients to perform oral hygiene after each meal, such as brushing teeth, which it can help to freshen the mouth by moistening the oral mucosa membrane and prevent ulceration from become more worse. The last nursing diagnosis that is related to this patient is altered comfort related to ulceration secondary to chemotherapy, as evidenced by patient verbalized pain score of 2 out of 10 and felt uncomfortable in mouth, especially when eating and drinking. So the interventions that we can do to this patient is assess the oral cavity once daily and note the pain score from 0 to 10, which can ensure the ulcer will not getting worse and can perform immediate intervention. Secondly, encourage patient to have diversional therapy such as listening to music to help patient to not think more about the pain. Thirdly, inform patient that the side effects of getting ulcer after chemotherapy will not last long. So by informing the patient, it can help to minimize patient's anxiety due to the pain. Lastly, administer analgesic as prescribed by the doctor, and it can help to relieve pain and the ulcer will heal more faster.
In conclusion, cancer can be defined as uncontrolled growth of abnormal cell and become invasive where it can influence normal cells, blood vessels and tissues. In Malaysia, cancer is the fourth biggest killer and nasopharyngeal is one of the common type of cancer that occur among men. Nasopharyngeal cancer happens when the malignant cell accumulated in the tissue of the nasopharynx that is located behind the nose and above the back of the head. Thus, common treatment for cancer are chemotherapy and radiotherapy, which helps to kill the cancerous cell.